that this meeting is being recorded, and we'll move on to questions after the briefing. CEO?
Okay. Sorry about that. So with this past weekend, we reported about 5 deaths, and we are, again, we are very saddened to hear of the deaths, especially right during the holidays. Our hearts go out to the families of all those who lost their lives due to COVID and or any other health conditions, actually. So this is a grim reminder that we still need to protect ourselves and our community from COVID in cooperation with the great efforts by the public health and medical teams. I want to pass it on to Dr. Khan to talk about the statistics. And before that, I just want to remind everyone that behind these statistics, they are individuals, they are loved ones, and we need to be respectful of that. So go ahead, Dr. Khan, and talk about the statistics, and we will go from there. Thank you.
Thank you, CEO Munya. So since the beginning of the pandemic, there have been 18 deaths in CNMI. Now, this is tragic, but fortunately it represents about 1/2% of all the cases. So the clinical efforts have been quite excellent, and there have been 38 deaths per 100,000 people reported in CNMI. And let me put that into context. So as a reference for the whole United States, there have been 824,190 tragic deaths. And there it's 1.5% of all reported cases, so 3 times higher than what you're seeing here in CMI. And the mortality rate in the US is 250 deaths per 100,000 people. So that's about 8 times higher than what's being seen here in CMI. And I believe this is a reflection of the excellent public health and healthcare efforts underway here in the community. The vaccination rate, for example, is quite excellent, and other focus on public health and social measures. Now, let me provide some specifics, as the CEO requested, on the recent deaths. So since, as I said, there were 18 total deaths, but since this recent surge in cases that you have had, there have been 15 deaths. Now, of those 15 deaths, tragically, 9 had never been vaccinated, 1 had a single dose, and 5 were fully vaccinated. But none of these people had a booster dose, even though vaccines are readily available. Now, these 9 people who have never been vaccinated is tragic and unfortunate, but it's a reminder that in a community that's highly vaccinated, this disease is very, very deadly for the unvaccinated. Of those who died, they were 65 years old, and this is much higher than what we see in the community. The community infections, on average, those individuals about 30 years old. And the range of the deaths is not just those 65 and older. The range of deaths has included somebody who's 43 years old, all the way to somebody who's 95 years old. Another thing we've noticed examining these deaths is that many of these individuals came in late. They were already severely ill and needed to be hospitalized. When you come in, you already need to be hospitalized, then we do not have a number of tools available to us, such as monoclonal antibodies, to individuals. And so the recommendation is that the moment, especially if you're high risk, have high risk conditions, please get tested so that you can make these new therapies available to you. So we can make these new therapies available to you. The health system can make them available to you.
Is he cutting off,
and I'll
or
turn
am
it
I
back
the
over
only
to
one
the
hearing it?
CEO.
Yeah, just a little bit for me at least. Dr. Khan, do you mind repeating just the last segment about being able to come in before?
I'll be glad to repeat the last segment. Most of these individuals, they were diagnosed late, and therefore they were not eligible for monoclonal antibodies. And this is a wonderful treatment for people if they're identified earlier in this illness. And so this is a message that if you have high risk illness, if you high risk conditions, if you think you're sick, if you've been exposed, please come early to get tested. And therefore, the health system could make these monoclonal antibodies and soon new oral drugs available to you. And I'll turn it over back to the CEO.
Thank you, Dr. Khan. So again, our messaging today, like any other day, will focus on prevention of hospitalizations and severe illnesses. This is a new year, so let's try to make it good for all of us. We are reminding everyone that the pandemic is not over. Please get vaccinated, as Dr. Khan mentioned. If you are vaccinated, get your booster shot, especially if you're over 60 years of age or have chronic conditions. Even before visiting your vulnerable family member, make sure you obtain a negative test. Dr. Khan mentioned about the availability of tests. Come early to get tested if you are infected, so we can treat you with the many new therapeutics. I'm sorry, with the many new drugs that we have available. Come early to get tested if you think you're infected, so we can treat you. That's the message that we're reminding everyone. So again, get ourselves vaccinated if you haven't, or we haven't. Get the booster shot if you're due. Get tested so that you can add a layer of extra prevention of spreading to your family and friends that are most vulnerable. We ask everyone's assistance in sharing the right information about the efficacy and safety of these vaccines. We're also asking for anybody with questions about the vaccines to direct their questions to vaccinatecnmi.com. Again, it takes time for your body to build protection after any vaccination. People are considered fully vaccinated 2 weeks after their second shot of Pfizer or Moderna vaccine, or 2 weeks after the single dose of J&J Janssen vaccine. Those information is again available at vaccinatecnmi.com. As we mentioned, as Dr. Khan mentioned, one of the deceased was partially vaccinated. Again, it takes time. And especially those that have not gotten their booster shots, we know that the vaccine efficacy wanes over time. This is true with any other vaccine. So I also want to remind, I know that during the holidays, we did see a dip in testing. Individuals wanting to be tested. Our testing has not stopped and will continue for as long as we have to. We are urging again those that can get tested, please sign up for testing. We have them daily, and we understand that also the fire station is also continues to conduct tests. For those that want to get vaccinated or want to get their boosters, again, go to the MPC Multipurpose Center, get the booster shot. It's free, accessible for anyone. And we are also doing homebound vaccinations for those that need it. You can call 670-682-7468 or 670-682-SHOT. So again, that's the message that we would like to share today. Yeah, we're ready for questions. Thank you.
All right, thank you, CEO and Dr. Khan. Yes, Tomas.
Hi, Doctor and CEO. I just wanted to start with the recent case reports showing that the hospitalizations, at least at the last point in time, was almost split between those who are vaccinated and those who are unvaccinated. I guess just to preface my question, in Guam, that's also something that we continue to see in our vaccinations, is split hospitalizations for both the vaccinated and unvaccinated. Is it too early to be concerned about this split in hospitalizations, or what is your comment on those case statuses?
I'm not quite sure. Dr. Khan, do you want to answer that?
That's quite and thank you for asking it, because it's a really good about what tools are. So we are reviewing the data again.
I think I'm not sure.
Yeah,
let me.
It's cutting out for me too.
1 second.
Okay.
Vaccination rate. So it's a reminder to get vaccinated.
Well, we are seeing a split. Yes, we are seeing a split in hospitalizations as well. And again, some of them have chronic conditions. And as I mentioned earlier, that some of this, the deaths that we've had over the week, this past holiday weekend, are not all basically COVID, right? So there is always a concern about the CNMI health status here in this, especially for our people. So we want to be able to remind them, everyone, that we still have the vaccines. They're a great tool for prevention of hospitalizations and severe illnesses, and we're urging everyone to get vaccinated if they can. I'm not sure if I answered your question, Thomas, but I hope that Dr. Khan can answer that as well.
Yeah, Dr. Khan, if your internet is stable, would you mind just repeating what you said?
Can you hear me?
We can hear you.
Now we can.
Okay, my apologies about the internet. So that was an excellent question. We will review the data again this week. When we last reviewed the data last week, of 13 people hospitalized, 10 had not been vaccinated. Now, and this is in a highly vaccinated community. So that tells you that this virus is seeking out those who are not vaccinated. So the focus is to get those who have never gotten a single dose, to get them vaccinated, and then continue to ask those at high risk to get them all the way to boosted.
All right, thank you. And then my last question is about the CDC's recommendations on quarantine being shortened to 5 days for those who are not symptomatic. Is the CNMI going to adopt any new rules given this new recommendation?
Not at this time. Thomas, there is at the end of the day, the states can always and territories can always be more conservative and have been more conservative than what CDC provides as guidelines. And considering our situation here in the CNMI, where there is widespread transmission, as well as our sick population, many with comorbidities, and we want to make sure that we do this in the right way. Of course, there are steps for when do we change to a crisis management versus a conventional, or basically we want to make sure that this is all done in the right way. Conventional contingency, I'm sorry. So right now at this point, we are definitely on a contingency response, and we are doing our very best to make sure that our services, our healthcare system is able to manage the current situation. So right now, to be able to put more risk to our capacity would be not very wise at this time. So right now, we would like to maintain our current quarantine protocols.
All right, thank you. That's all for now.